In this session, we will try to discuss about pectoral region. In this topic, pectoral fascia, pectoral muscles, clavipectoral fascia. These are the topic we are going to cover. First, if we take pectoral fascia is nothing but deep fascia of pectoral region. As soon as removal of skin, you will get superficial fascia, right? After removal of superficial fascia, you will get deep fascia. Of course, in case of females, you will get mammary gland. That we will study in the next session. Now, pectoral fascia, pectoral muscles, clavipectoral fascia, right? First, if you take pectoral fascia or deep fascia of pectoral region, it attaches medially to the sternum, superiorly to the clavicle, right? After attaching here, it has to go laterally, right? So, in the upper part, it is going towards the deltoid muscle. In the lower part, it is going towards the axilla, right? That's what this lateral part we are dividing into superior lateral part, inferior lateral part. First, if you take superior lateral part, it covers the subclavian fossa, then deltopectoral groove. After that, it continues as a deep fascia which is covering the deltoid muscle, right? Very simple. Below the clavicle, there will be fossa. That fossa what we call subclavian fossa. At the junction of deltoid and pectoralis major, there will be groove. That groove what we call deltopectoral groove, right? Superior lateral part covers the subclavian fossa and deltopectoral groove. After covering these depressions, it continues as a deep fascia which is covering the deltoid muscle. That's it. Then inferior lateral part. This inferior lateral part, after winding around the inferolateral border of pectoralis major, it continues as a axillary fascia. That means deep fascia of axilla, right? Then in the lower part, it continues as a deep fascia of the chest. That's it about pectoral fascia, right? Then muscles. After removal of deep fascia, you will get muscles. Pectoralis major, pectoralis minor, then subclavius, right? These three muscles we have to study strictly, but for our convenience, serratus anterior also we will study here only, right? First, if you take pectoralis major, when you are studying about any muscle, we should study under these headings: origin, insertion, nerve supply, action, right? First, we are taking origin of pectoralis major. See here, I have already drawn thoracic cage and some bones which are in relation with the upper limb to avoid time consumption, right? See here, this is clavicle, this is sternum, of course this is manubrium sternum, and this is body of sternum, and this is Giffard process, right? And this is coracoid process, this is acromion process, and here clavicle and sternum articulating here to form the sternoclavicular joint. Clear? And here this is glenoid fossa, and this is head of the humerus, and tuberosity here. This is lesser tuberosity of the humerus, and this is the greater tuberosity of the humerus. In between these two tuberosities, here you can get one groove. This groove what we call bicipital groove or intertubercular sulcus. Very simple. It is present in between the two tubercles. That's what this canal what we call intertubercular sulcus, right? And through this sulcus, long head of biceps is passing. That's what this sulcus we can also call as bicipital groove, right? Then see, this is greater tuberosity, this is lesser tuberosity, and this is intertubercular sulcus. This intertubercular sulcus having lateral lip, this is lateral lip, and this is medial lip. This is lateral lip and this is medial lip, right? Very simple. If you take any groove like this, any groove, it will be having the two lips. Then only it will become groove. Is it or not? So this is one lip and this is another lip, right? So this is lateral lip and this is medial lip, right? Actually, that lateral lip is going to give insertion to the pectoralis major. Medial lip is giving insertion to the teres major, right? And the floor or in between these two majors, there will be latissimus dorsi insertion, right? Simply you can remember lady between two majors. Lady means latissimus dorsi, two majors, lateral lip, pectoralis major, medial lip, teres major, right? See, pectoralis major having clavicular head and sternocostal head. Clavicular head arising from the anterior surface of medial 2/3 of clavicle. See here, this is lateral 1/3 and this is medial 2/3. So this is the anterior surface of medial 2/3 of clavicle, right? Then anterior surface of manubrium sternum, anterior surface of body of sternum up to 6th costal cartilage, up to 6th costal cartilage, right? Then aponeurosis of external oblique muscle, otherwise external oblique aponeurosis, right? So it takes origin from all these areas, right? Very simple. Clavicle, which part of the clavicle? Medial 2/3 of anterior surface of clavicle, right? Then anterior surface of sternum, both manubrium sternum and body of sternum. Clear? Up to where? From 1st to 6th costal cartilage, right? Then upper 6 costal cartilages, upper 6 costal cartilages, right? And if you wanted to become more specific, sternal end of 6th rib also, that means 6th costal cartilage and also 6th rib, right? So these are the origins. Okay, don't confuse, I will repeat it once again. See, this is clavicular head of pectoralis major. It takes origin from the medial 2/3 of anterior surface of clavicle. Then sternal head, anterior surface of manubrium sternum and body of sternum up to where? Up to 6th costal cartilage, right? Then costal origin, costal origin from the upper 6 costal cartilages. These are costal cartilages which I have drawn with green color. And if you wanted to become very specific, along with 6th costal cartilage, 6th rib also. Then abdominal part, abdominal part means this muscle arising from the external oblique aponeurosis, external oblique aponeurosis. Actually in the abdomen there will be outermost muscle will be there, that muscle what we call external oblique muscle. That external oblique muscle, it forms aponeurosis in the front part. That aponeurosis gives origin to the pectoralis major, right? So these are the origins, right? Now this muscle, where it has to go and insert, it will go and insert to the lateral lip of intertubercular sulcus, right? See, origin is very broad, but insertion only small place, here only it has to attach, is it? Then how it will be inserted? It will be folded and becomes U-shaped, right? Then it will be inserting as a U-shaped manner. It will be inserting as a U-shaped manner to where? To the lateral lip of intertubercular sulcus. Clear? So let me draw that. Clavicular fibers and manubrial fibers. Clavicular fibers and manubrial fibers attaches to anterior part. That means this part. This is anterior, this is posterior. This part. That means anterior limb of U formed by fibers which are arising from the clavicle and manubrium. Manubrium sternum. Sternocostal fibers and abdominal fibers. Abdominal fibers means fibers which are taking origin from the external oblique aponeurosis. Right? These fibers will go like this and they will be twisted and inserted here. Right? So these sternocostal fibers attaching as a posterior limb of U-shaped insertion, right? So in this way, this pectoralis major muscle will inserted to the lateral lip of intertubercular sulcus, right? So let me draw this muscle, right? So see here, it is inserting as a twisted manner, right? That's what this insertion is U-shaped. This anterior limb of U-shaped insertion is by the clavicular fibers and manubrial fibers. This posterior limb of U-shaped insertion by sternocostal fibers. Clear? So that's it about pectoralis major origin and insertion. Now, what is nerve supply? Medial pectoral nerve and lateral pectoral nerve, right? Actually, they are the branches from the brachial plexus that we will study in the axilla, right? At this session, just you remember that pectoralis major supplied by medial pectoral nerve and lateral pectoral nerve, right? Then, what are the actions? Adduction of shoulder joint, medial rotation of shoulder joint by pectoralis major as a whole, right? If the whole muscle contract, it leads to adduction and medial rotation, right? Then, if only clavicular fibers contracts, flexion of arm, right? Then sternocostal fibers, if the sternocostal fibers contracts, extension of flexed arm. Here don't confuse. See, this is the flexion by what? Clavicular fibers, right? Then sternocostal fibers extend the flexed arm. That means already it's flexed. This flexed arm has to come to the neutral position, right? So this action, that means extension of flexed arm by the sternocostal fibers, right? That too against the resistance, right? So simply remember that total muscle contracts leads to adduction and medial rotation, right? If clavicular fibers contracts, flexion. If sternocostal fibers contracts, flexed arm will be extended against the resistance, right? So these are the actions of pectoralis major. Clear? So that's it about pectoralis major. Then pectoralis minor. See, pectoralis minor arises from the third, fourth, fifth ribs, not costal cartilages. You should be strongly remember this. This muscle arising from fifth rib, then fourth rib and third rib, right? So this is the origin. This is the origin of pectoralis minor, right? Very simple. It is arising from the third, fourth, fifth ribs at the costochondral junction, but it is not arising from the costal cartilages, right? From here, it goes upwards and laterally and inserted to where it is inserting here. See here, it is inserting to the coracoid process, right? Medial border of coracoid process and superior surface of coracoid process. Simply remember coracoid process, right? Coracoid process. So it is inserting to the coracoid process. Then what is the nerve supply of it? Same like pectoralis major, pectoralis minor also supplied by both medial pectoral nerve and lateral pectoral nerve, right? So this is the origin, insertion and nerve supply of pectoralis minor. Then what is the action? Action of pectoralis minor. Action of pectoralis minor is protraction of scapula. That means, see here, it is attaching to the scapula. That's what when this muscle contracts, this scapula will be protracted forwards. Imagine, scapula will be present behind. When this muscle contracts, scapula will be protracted forwards, so that shoulder will be protracted, right? So protraction of scapula, main function, and depression of shoulder tip, right? And it is helpful in the forceful inspiration. That means it is one of the accessory muscle of respiration, right? So this is about pectoralis minor. See, origin from the third, fourth, fifth ribs at the costochondral junction, insertion to the coracoid process. If you wanted to be specific, superior surface and medial border of coracoid process, right? Then nerve supply, medial pectoral nerve and lateral pectoral nerve, right? Action, protraction of scapula and depression of shoulder tip, and it is one of the accessory muscle of respiration. It will be helpful in the forceful inspiration. Clear? Then we will go for subclavius, right? All of you must be aware of it. Here clavicle is there. Underneath the clavicle, that means inferior surface of the clavicle, you can find one groove. That groove what we call subclavian groove. Subclavian groove, right? Here subclavius muscle arising from the first rib. See, this is first rib, right? It is arising from first rib at the costochondral junction. From here, it takes origin and it reaches to the underneath the clavicle. It reaches to underneath the clavicle, okay, and inserted to the groove which is present underneath the clavicle. That means subclavian groove. So it is inserting to the subclavian groove. This is the origin and insertion of subclavius muscle. Subclavius muscle arising from the first rib, inserting to the subclavian groove of clavicle. That's it. Then what is nerve supply? Nerve supply is nerve to the subclavius. It is a branch from the upper trunk at the Ebb's point. Clear? What is Ebb's point, how it will be formed, and what are the different branches from the Ebb's point, we will study in the brachial plexus. Clear? So we know origin, we know insertion, and we know nerve supply. Then what is the action? It studies the clavicle during the movement of upper limb, right? Subclavius muscle studies the clavicle during the movement of upper limb. Clear? So that is about subclavius muscle, right? Actually these three only pectoral muscles, but serratus anterior also you will study here only for our convenience. See, serratus anterior muscle arising from the upper 8 ribs as a 8 digitations. That means serratus anterior muscle arises by 8 digitations from upper 8 ribs. At which level? At mid-axillary plane, right? So at mid-axillary plane means here. From here it is taking origin, right? Imagine I am drawing from the first rib, second rib, third rib, okay, fourth, fifth, sixth, seventh, eighth, right? So it will be arising like this. Clear? So this is the origin of serratus anterior. Actually, this muscle will be present deep to the pectoralis major in the upper part, but still I am drawing above because we wanted to see these digitations. It is arising by 8 digitations from the upper 8 ribs, right? So after arising from here, it goes backwards deep to the scapula. Imagine this is the scapula, this is the lateral border, this is medial border, okay, and this surface is ventral surface or costal surface, this surface is dorsal surface, right? Now imagine serratus anterior muscle, after taking origin from the ribs, it winds around the chest wall, then it goes medially deep to the scapula, right? Then it reaches to the medial border of scapula. That to which surface? Ventral surface of medial border of scapula. Then it will come and insert it here, right? Let me draw the diagram. See, this is the medial border and this surface is ventral surface, right? Now the insertion of this muscle is here, right? So this is the insertion of first digitation, and here from here to here, this is the insertion of second and third digitation, and there is a triangular area at the angle. This is the insertion of last 5 digitations, right? So this is the origin insertion of serratus anterior, right? Very simple. After taking origin from here, it goes backwards and passes deep to the scapula and reaches to the medial border where it will insert it, right? So first digitation above the root of spine of scapula, then second and third along the medial border below the root, last 5 digitations at the angle, right? So that's it about the origin insertion of serratus anterior. Then nerve supply, long thoracic nerve of Bell. It is direct branch from the roots C5, C6, C7, right? So this nerve what we call nerve to serratus anterior or long thoracic nerve of Bell. Clear? Then actions. See, along with pectoralis minor, serratus anterior also protracts the scapula. That means scapula will be protracted forwards. This muscle is more helpful in the pushing and punching movements. That's what serratus anterior muscle we can also call as boxer's muscle, right? So first action is protraction of scapula along with pectoralis minor. Then rotation of scapula. Imagine this is the scapula and here glenoid cavity will be there, right? Rotation of scapula over the body so that glenoid cavity will be faces upwards, right? So this rotation will be happening during overhead abduction, right? So that action will be assisted by or associated by trapezius muscle, right? So this is second action. Then third action, it studies the scapula during carrying any weights, clear? And it is also one of the accessory respiratory muscle, right? So these are the actions, clear? What is the applied aspect related to the serratus anterior? Here I will try to draw one more diagram. Posterior surface or dorsal surface of scapula. This is the dorsal surface. Dorsal surface means we can found spine. So this is spine and this is the acromion process, right? See, imagine these are the spines of vertebrae. That means this is the midline in the back. This is the midline. So in the midline you can form spines of vertebrae, right? From the spines of vertebrae there will be two muscles which are arising from the spines of vertebrae. Okay, what are those two muscles? I will tell you in the back. Okay, at this session just remember the names only. This is rhomboidus minor and this is rhomboidus major. Rhomboidus minor and rhomboidus major. These two muscles pulls the scapula backwards, right? And serratus anterior pulls the scapula forwards, right? So these muscles are retracting back and serratus anterior is protracting forwards, right? So when paralysis to the serratus anterior muscle, these muscles will be overacted. That means they will hyperact and they retract the scapula backwards, right? There is no protraction because serratus anterior is paralyzed, right? That's what whenever the paralysis of serratus anterior because of injury to the long thoracic nerve of bell, which leads to winging of scapula. That means medial border of the scapula will become more prominent. It will be still more prominent when he is attempting to push against the resistance. That feature what we are calling winging of scapula. That means if there is injury to the long thoracic nerve of bell, which leads to paralysis of serratus anterior, which leads to winging of scapula. Clear? So that's it about the serratus anterior muscle. Now we'll study about clavipectoral fascia. Clavipectoral fascia. Actually, clavipectoral fascia stretches between the clavicle and pectoralis minor. That means here, this is the clavicle and this pectoralis minor. Here, there will be one fascia. That fascia, what we are calling clavipectoral fascia. Right? So, laterally, where it is attaching? Laterally, it is attaching to the coracoid process. Medially, it is attached to the external intercostal membrane of first and second intercostal spaces. Right? Very simple. External intercostal membrane is nothing but in the intercostal spaces, there will be external intercostal, internal intercostal, intercostalis intimus. That external intercostal muscle, posterior part, it is muscular, and the anterior part, that means at the costochondral junction, that muscle becomes membrane. That membrane, what we are calling anterior intercostal membrane, right? So here there will be membrane, right? This clavipectoral fascia attaches to the anterior intercostal membrane of first and second intercostal spaces. So from here to here there is fascia. That fascia what we are calling clavipectoral fascia. Right? Now we know horizontal disposition. Medially it attaches to or it blends with anterior intercostal membrane of first and second intercostal space. Laterally it is attached to the coracoid process. Clear? So now we have to see vertical disposition. If you want to see vertical disposition, we have to make the section along the clavicle, subclavius, pectoralis minor, then axilla. Right? So if you take that section, how it will be? Let's see here. This is the cut section of clavicle. If it is cut section of clavicle, in the inferior surface you can find the groove. What is this groove? Subclavian groove. So this is cut section of clavicle. Right? Below the subclavian groove, what is there? What is this muscle? This is the muscle. What is this muscle? Subclavius muscle. Right? Then below this subclavius muscle, what is here? Pectoralis minor. So this is pectoralis minor. Okay. Then here axilla. Below this axilla is there. Right? So this is axillary fascia. Right? So this is axillary fascia. If you want to draw still more details, here pectoralis this is pectoralis major, taking origin from the anterior surface of clavicle. Of course, it is surrounded by or covered by pectoral fascia. Is it? Now, clavipectoral fascia in the upper part, it attaches to anterior lip and posterior lip of subclavian groove. That means in the lower part of the muscle, it splits and encloses the muscle and attaches to anterior lip and posterior lip of subclavian groove, right? Actually, these posterior fibers blends with deep cervical fascia and axillary sheath, right? If you can remember, remember. Otherwise, just simply remember that it attaches to posterior lip of subclavian groove. That's it. Then, after covering the subclavius muscle, it fuses. That means both layers will be fused here, right? Then descends downwards. So that fascia will be here. Then when it reaches to the superior border of pectoralis minor, it splits again. It splits like this, right? Then it covers the pectoralis minor. Okay. Then in the lower border, again these two laminae will be united and becomes suspensory ligament of axilla and becomes suspensory ligament of axilla and attaches to, what is this fascia? Axillary fascia. Axillary fascia means deep fascia of axilla, right? So it attaches to the dome of axillary fascia. Because of this ligament only, in the axilla we can see the depression, because this ligament attaching to the summit of dome of the axillary fascia. Summit means what? Just imagine this is, if it is dome shape, this upper part is summit. So here it is anchored or suspended by suspensory ligament of axilla, right? That's what this dome is maintained. Clear? So this is the vertical disposition, right? If you want to go still more details, at the lower border of subclavius muscle, this membrane will thicken and forms the one ligament. That ligament what we call coracocostal ligament, because it is extending from the coracoid process to the first costochondral junction. Now, what are the structures which pierce the clavipectoral fascia? Right? That we will see now. Axillary vein and axillary artery. That means axillary artery is here, axillary vein also here, right? See, cephalic vein which is present at the lateral part of the arm, which goes upwards, right? Then it curves medially and it passes through the deltopectoral groove and pierces the clavipectoral fascia. That means it will pierces the clavipectoral fascia and opens into axillary vein. That means first structure which is piercing the clavipectoral fascia is cephalic vein, right? Remember that, cephalic vein. Then lymphatics which are draining from the breast and pectoral region. Of course, those will be draining into the axillary group of lymph nodes. Clear? Then thoracoacromial artery. Thoracoacromial artery is a branch of axillary artery. After piercing the clavipectoral fascia, it comes out here and it will divide into 4 branches. One branch to the clavicle, one branch to the pectoral region, one branch to the deltoid, and one branch to the acromion process. Otherwise, remember A, B, C, D. A for acromion, so acromial branch. B for, actually it's a pectoral branch. To make it A, B, C, D, it's a breast branch. Then third one is C, clavicular branch. D, deltoid branch, right? So thoracoacromial artery also pierces the clavipectoral fascia. So third one completed. Then fourth one is lateral pectoral nerve. Lateral pectoral nerve, right? So these are the structures which pierces the clavipectoral fascia, right? So this is about pectoral region and clavipectoral fascia. I hope you understood. Okay, that's it for today.